Okay. Welcome, welcome, welcome. So good to see new faces, different faces. So welcome to the first ever Parent Creator Conference. It's been a tough year for parents. I am also a mother, so it's my great pleasure to welcome all of you today. I'm a mother of an amazing, wonderful 8-year-old. So first of all, you're here to get an update on two of the many pressing issues facing parents, the formula shortage and also the vaccine for children under 5. We are so lucky to have two people who can answer your questions directly, and I'd like to introduce Admiral Levine and Dr. Jha. So I don't know who's coming up first.
I think we're waiting for their questions.
Okay. Oh, so I stand here and take, okay.
And then we can do
Okay, I didn't know if you guys wanted to say a few things
Sure.
first, but whatever. Well,
Why don't we go with Dr.
okay.
Levine first and then
Yeah, why don't you say a few things and then
Sure.
we'll get it started.
Well, thank you so much. I'm really pleased to be here. I met many of you at the executive office where we were talking. So I'm Admiral Rachel Levine, the Assistant Secretary for Health, and most importantly, I'm a pediatrician and have been a pediatrician for probably almost 40 years. So it's a long time at Mount Sinai, and then most of my career at the Penn State College of Medicine. So I'm really pleased to answer your questions about the formula shortage that we've had, and we're making a lot of progress, but I know a lot of concerns, so very pleased to answer your questions.
Awesome.
Great.
Dr. Jha.
Yeah. Hi, everybody. Ooh, this is the problem with masks. Sometimes your glasses get caught in them. So good afternoon. Thanks for having me here. I'm going to talk to you about kids under 5 and vaccines. Now, many of you are probably following that, like, the FDA is going through its process. CDC is going to make a decision in the next couple of days. We'll hear from the FDA tomorrow. Lots of parents I know around the country, lots of my friends who are parents of kids under 5, very excited about this moment. Whoa. Very excited about this moment. I'm not going to get ahead of where the FDA and CDC will land. The data on vaccines for kids over 5 is really overwhelmingly clear. These vaccines are incredibly safe. They're highly effective. I've got 3 kids who are over 5. All of them are vaccinated and boosted. Did it for a very simple reason. It really does work in terms of protecting children. Last point, just so you guys are tracking timeline, FDA will make a decision tomorrow. Should they move forward? CDC is going to make a decision by Saturday. Vaccines are going to start getting out there. We're going to ship them on Friday after FDA's decision. And next week, we're going to start seeing the first set of vaccines going into little arms and little legs, and then more appointments for vaccines in the days and weeks that follow. And in the next few weeks, we expect any parent in America who wants a vaccine to be able to get one. So excited to answer your questions.
All right. Thank you so much, Admiral Levine and Dr. Jha. Okay, so we're going to take some questions. Also, I have to say, there are these cute little, amazing, wonderful nuggets here. Hi. They are so adorable, and they're so well behaved. Thank you, moms, for bringing them in. Okay, so let's go ahead and take a question. Let me see. All right, go ahead.
I'm hearing from mom friends that every time they go to the store, there's a different brand on the shelves. So it's basically impossible for them to have any kind of consistency. Is there any advice for moms who have had to switch formula brands multiple times?
So thank you for that question. That's come up a lot. So I know that usually you would go with one brand, usually the one recommended by your pediatrician or family physician, or if you're on WIC, the one that's for WIC for your state, and then you would stick with that brand. But actually, for the vast majority of infants, it is fine to switch brands of formulas. So, you want to use the same type of formula that you've been using. So, of course, the regular cow's milk-based formula, then there might be the soy formula or hypoallergenic formula. If you have any question, talk to your pediatrician. But if you've been using the regular formulas, and there's Similac and there's Enfamil and there's Good Start and some others, you can switch between all of those regular formulas, and then there's some new formulas from overseas, from Australia, and you can switch to those as well. It might take a little while for your baby, if your baby's been on one, to get used to the taste. It might have a slightly different taste, but usually if you work with them, they will adapt to the new taste, and they'll be fine. For all the basic American formulas, you prepare them the same, but for the international formulas, they're going to probably use the metric system, and you want to make sure that you use the right amount of powder and the right amount of water, and you mix it according to the instructions. And if you go to the main website, then it'll give instructions about how to do that. So now if you're on soy formula, then stick to one of the other soy formulas. And if you're on really specialized formula, you should talk to your pediatrician. But it is fine to switch.
Great.
Hi. So during this shortage, as moms are really, struggling to find it in stores, I've been seeing in my own local community mom boards, folks recommending homemade recipes. Carnation milk, goat's milk, Karo syrup. Those are all being described as alternatives. Some may have even been fed this themselves as infants and, lived to see the day. So can you tell us why experts are advising against making homemade formula?
So that's a really good question, which has come up a lot, and we really do not advise making your own formula. So even, be honest with you, when I was a pediatrician seeing patients in 1987, 88, 89, 90, we didn't recommend making your own formula. It is not possible to get all the nutrients and all the vitamins and minerals that you might need from homemade materials to produce really the balanced nutritional product that your baby needs in terms of formula. So we do not recommend that. You really need to use one of the different brands that we've been talking about. And again, the international brands are fine. They've all been checked by the FDA for safety and effectiveness and really provide the balanced nutrition that your baby needs. But it is not possible to do that at home. Formulas have really improved a lot. There's a tremendous amount of research that goes into what are in your baby formulas. And so you have to be really, really cautious, and you can't do that.
Go ahead.
Hi, my name is Grace Bastidas, and I'm the editor-in-chief of Parents. So you mentioned WIC previously, and almost half of all babies receive WIC benefits, which really limits the kind of formula low-income families can get. Those limitations have been relaxed during the shortage. Are there plans to widen the options for these families who historically have a hard time getting the formulas they need, especially if their children have nutritional needs?
So, yes, the WIC regulations in terms of formulas has been relaxed during this time. I don't control WIC. I doubt that that will continue after this shortage, meaning the reason why WIC, your state has a specific formula through WIC and the USDA is that they negotiated a contract it's not done for nutritional reasons, why they pick Enfamil or Similac or Good Start or one of the other ones. It's done because they negotiated a really good contract. So when I was in Pennsylvania, as the Secretary of Health, WIC was under me. Now it's not now because it's a United States Department of Agriculture program, but it was under me in Pennsylvania, and we would work to negotiate a contract so we could get more formula for the same amount of money. And all the states do that, and they might be using different formulas because they negotiate different contracts. So I don't think it's going to go back to use that more flexible formula forever, but that's the way it is now.
Why don't you stay right here?
Yeah. Did you have a follow-up?
Yes. So as we all know, and part of the reason why we're here, it's been a very rough time for moms. Many of us are feeling like the universe is like turning on us. First, we hear that there's a shortage of tampons, and now we also hear that the Abbott factory is actually flooding.
Right.
Can you tell us or give us like a timeline on exactly when this shortage will end?
Sure. First of all, it has been a really challenging year. Actually, it's probably been a really challenging 2.5 years. But this year, in terms of the formula shortages, on top of the pandemic, et cetera, is just really difficult. And it's really difficult for you all, for parents of young babies and young children, and this has just been really difficult. I can tell you that this is an absolute priority for President Biden. This is an absolute priority for Secretary Becerra, Secretary of Health and Human Services. I know it's a priority for Dr. Califf and the FDA. And the administration is really doing everything that we can. We are pulling the full force of the federal government to ramp up production and to increase the supply of safe, infant formula. We do expect more and more formula to be coming on shelves over the next number of weeks, and that's in retail settings, in grocery stores, online, directly from manufacturers, WIC, and other places. This week alone, there are 10 Operation Fly formula flights scheduled by June 19th. And that will transport nearly 13 million 8-ounce bottles to the United States. And another airline has donating free flights with Delta, carrying a product called Kendamil to the United States from England. And we also are working with domestic manufacturers to ramp up production according to the Domestic Production Act. They're entering in a consent agreement between FDA and Abbott to reopen the Sturgis facility. I'll get to the closure and the new closure in a second. We're bringing in more manufacturers and more formula not produced in the United States, and we will do more. We'll do everything we can to get formula on the shelves so that you can feed your babies. It is really challenging that the weather has been another disruption, and obviously unforeseen. The plant was flooded. The company made the right decision to shut down the facility they can determine the extent of the damage. Abbott which is the company, will quickly assess that. They will talk to the FDA. The FDA, I know that the head of the FDA spoke with the CEO last night, and they will continue to have discussions. The FDA will return to the facility on Friday to work with Abbott to make sure that when they're ready, that they can start to produce safe and quality formula. Of course, it has to make sure the plant is really set to go, and that's our responsibility to make sure it is, and their responsibility to get it done. So we really think that with the ramp up of formula production in the United States, plus the Fly formula missions, that we're going to have more formula on shelves over the next several weeks. So the plant issue is really challenging given everything else, but it will be rectified.
Go ahead. Hi, Julia Dennison, Senior Editorial Director at Parents also. You're seeing a lot of third parties profiting from the formula shortage. How are you working to stop formula price rising? And also there's been a lot of price gouging and just scams all around.
May I get that one to you?
Oh my gosh. Okay.
I don't have granular knowledge about that. So.
Well, we know that there's like 4 manufacturers, right? And it is that control kind of the baby formula production, and Abbott itself has like 40% of that. And so one of the things is that we have clearly, we have asked, FTC is going to look at this on the price gouging. That is something that clearly is hurting parents and families and caregivers, and it's not a productive situation. So it's something that we are monitoring. FTC, which is an independent agency, will take a look at that. But we know that has been clearly an issue for parents and for caregivers. So that is something that's on our radar. Okay. Go ahead.
Hi, Keir Gaines. I am a husband, a father, and a content creator. Long-time listener, first-time caller. I asked my audience what they would like me to ask you, and here's what I have. The question is, will there be any FDA regulation modifications related to the foreign supply formula to ensure that this doesn't happen again?
Well, I know that the FDA is taking this extremely seriously. And so clearly they've made modifications in terms of bringing in formula from other countries now. I don't know if that will continue in the future. I mean, really previously, our formula manufacturers really had a really good handle on the need for formula for babies in the United States, and there were no shortages. So, I mean, this was really caused and triggered by the closure of the plant at Abbott in Sturgis, Maryland, because of contamination of the formula with bacteria, and the FDA is responsible for regulating that and for taking in this decisive action, and that's what they did. I think that's going to be an unusual experience, and we haven't had that before, and we'd like to hope we won't have that again. So we don't expect this to be a long-term problem, this was really triggered by the closure of that major plant from one of the country's largest manufacturers. The FDA will be looking at all of their policies and procedures, so, internal review about how all of that investigations and their regulatory oversight of that plant happened. If there are changes that need to be made to improve their oversight, they will make them, and they're going to look at that really, really carefully. Right now, the concentration is on getting formula on shelves, and they have a tremendous amount of work being done to ramp up production in the United States, make sure all that formula is safe, which it is, to get safe formula, nutritious formula from other countries. But there will be an investigation, and whatever changes need to be made in their oversight, they will make.
Because it's been so hard, parents have really been trying to have each other's backs, and because of the internet, it's easier to sort of crowdsource. So we're seeing a lot of posts in our neighborhood groups and, say, Facebook mom groups of parents who have extra formula, additional formula that's unused. Is it safe as long as it's sealed to get formula from a stranger?
Well, it is wonderful that people are banding together. One of the things the pandemic has taught us is that, we're all interconnected, is that, we all have to help each other across the nation. That is one of the president's main messages, is that we are one nation, and we have to pitch in together and to help each other. So I think that if as a last option, that's what you need to do. I think you could do that. It absolutely has to be sealed. I would not use formula from an open container from a stranger because you do not know about that. I would use your best judgment, from in terms of that. You should always look as you open the container for any, as you always do, for any color change or smell change or taste change. I would make sure that if you're getting like a case, that the lot numbers of the case and the dates, the use by dates, are the same as they are on the can or the bottle, because they shouldn't be different. If they're all in that same case, then they all should have the same numbers, the same lot numbers, the same use by dates. I would check the containers to make sure they're not open, check for any damage. And so, as a last resort, yes, but I would use caution in this day and age.
Go ahead.
Hi, my name is Kim. Not that it matters much, but hello.
Hi.
It does matter. Thank you. Hi, Kim. It appears that COVID-19 impacts older kids more severely than younger kids. I guess that would be for you, sir. So why should parents take steps to vaccinate their younger children if they're not as much as a risk as the older children?
Yeah, it's a great question. So, there's been a lot of misinformation in this pandemic, especially about COVID in kids. And people often point to, and I'll get to your specific question in one second, but often point to that kids are lower risk than adults or the elderly. That is totally, in my mind, the wrong comparison. Actually, kids are always at lower risk than the elderly for pretty much every disease. That's the real question, is how does the risk of COVID compare to other risks that children face? So if you have a 4-year-old, you're not asking, is my 4-year-old at lower risk than my 14-year-old? You're asking, what are the risks to my 4-year-old and how does COVID compare to other things I might vaccinate against? So let's look at what we know about kids under 5. Almost 50,000 of them have been hospitalized because of COVID infections. And these are just kids under 5. A quarter of them in the ICU. 2/3 of these children had no comorbidities. When you compare COVID to other illnesses, it is a serious illness for children. Now, the next part of the question is, what do we know about the vaccines? And again, we're going to hear a lot more about the kids under 5 vaccines, but the data on kids 5 and above, overwhelmingly clear, highly safe, or very safe, highly effective. So I always sort of remind people, the question you want to ask yourself is, what's the thing I can do to lower the risk for my kids the most? And in that context, it really is no-brainer. The vaccines are safe and effective, and they lower the risk of complications.
Hi, I'm Catherine. Is there safety data? Is one of the things they're looking at for under 5-year-olds, like how it interacts with all the other vaccines kids are getting? Because especially really little kids are on such regular vaccine schedules. Is that something they're looking at?
Yeah, so the clinical trials are in kids under 5, and those kids are getting vaccinated with everything else, and they're looking at a whole host of effects on children. And one of the things that's really amazing about your immune system is it is able to handle multiple. We handle multiple infections over weeks and months, right? So the immune system is able to handle getting vaccinated against multiple infections quite effectively. And there's really no reason to think that adding this vaccine will disturb the others, but they're certainly tracking that in children. And all the data so far suggests these vaccines are incredibly safe, including in terms of interactions with other vaccines.
Just to follow up regarding girls, we hear a lot just between moms about parents waiting if their daughter in particular hasn't yet gotten her period because there was a rumor of a link between fertility and the vaccine. Can you just clarify if that's misinformation or if there's any link at all?
Yeah, it's a great question. So to cut to the chase, it is total misinformation. There is zero scientific link between these vaccines and infertility, menstruation, any of those issues. But I want to make a slightly bigger point. We see this with every vaccine. The issue of infertility is raised by anti-vaxxers. They did it with HPV vaccines, they've done it with measles vaccines. You name the vaccine, it's the favorite go-to source of misinformation. Oh, this causes infertility. And I've often asked, why do they focus on infertility? And because infertility is hard to disprove, right? It's hard to disprove it, no. Second, it's something that people care a lot about and feel anxious about. So it's a favorite tactic of misinformation. The science on this is really clear. There is no link whatsoever to infertility, to menstruation. So I have 2 teenage daughters who both got vaccinated pretty much as soon as they were eligible. And for me, that was a very clear decision. They actually made the decision because at this point I make no decisions for them, let's be honest. But I was very encouraging of their decisions, but it was not a close call.
Going back to the formula shortage thing. So obviously there's a lot of talk about how nursing is a go-to solution, but speaking for dads, that's kind of like watching a kid adjust the thermostat. I cannot do it. So what? And I know the same is true for a lot of moms who either choose not to or can't. What can dads do to help in that situation?
Sure. Well, thank you for that question. First, I want to get back to about the website. So it's hhs.gov/formula. Might have anticipated that, but hhs.gov/formula. It's a really good question. Of course, breastfeeding is best, and so we do recommend that women breastfeed. It's kind of hard to go back sometimes. So if a baby's been on formula for a significant period of time, it is in theory possible to go back to breastfeeding, but in practice, that's really difficult. But I think that dads are absolutely critically important. And so if you're bottle feeding, then of course you can bottle feed as easily as mom can bottle feed. And so you can participate in that. But I think that other things that dads need to do, I know that families go out on formula searches. And so, searching for formula, whether it is calling or driving or, making, an internet or whatever, looking for formula, maybe going on that website that I forgot, talking to the pediatrician and talking to the family physician about what needs to be done. The other is that, there's a lot of things that need to be done at home. Now, you might have other children. Well, you can take care of the other children while mom is feeding the baby. Or you can you can wash the clothes that are piling up, or you can, there are so many other ways that dads can help at home for families with young children. So I think that is absolutely, all right. I think it is absolutely critical, and it's so fantastic for, to be fully participatory in the care of the children. And if a mom is breastfeeding, there's so many other things to do. And if the mom's bottle feeding, then you can switch off and everything. But families and moms and babies need their dads.
There you go. All right. Way in the back. Go ahead.
Hi, yes. So my name is Lao Nguyen. I'm a first-time mother of twins. So I want to know, what efforts by administration are being made to help families regain trust in AVA and other manufacturers.
Yeah, I think that that's really hard. I think that once trust is lost, it needs to be earned back. And I think that the baby formula business has threatened that trust. And so I think that by working with the administration and all the things that we are doing, we are really having great participation by the formula manufacturers, all of them. So Abbott is doing everything they can. Their plant was just starting, and then they had weather, but they will get it back. We'll make sure that it's right when they do. But I think that their CEO has apologized for the challenges that they had originally with the bacterially contaminated formula, and I think that they are dedicated to do the right thing. I think all the other manufacturers are gearing up and producing more. And then, I think that they are partnering with us in the White House, the federal government, with HHS, to really supply the needs that you all have as parents of young children. So I think that by their words, but even more important, by their deeds, they will earn back our trust.
Who's called someone and I haven't called them yet? Go ahead.
Hi there, I'm Maya, first-time mom.
Hi.
I know several mothers, myself included, who have looked to donor milk banks as providing alternatives to formula or for those who are unable to breastfeed. Are there any efforts that are being made to engage with donor milk banks?
So we have had discussions with milk banks. I think that they can serve a real need. I have to tell you that most of the milk from milk banks goes to hospitals. And so for babies that are hospitalized, for example, babies in the newborn intensive care unit, or babies, young babies that might be in pediatric children's hospitals and in the units. And so it might be possible for milk banks to have express breast milk, processed through their bank that is available to the public. But to be honest with you, I wouldn't expect that that's going to serve most of our needs, because almost all of that milk goes to babies in need in children's hospitals.
I actually have a question for Dr. Jha. Hi. You answered so many of our questions last week when we met with you with parents. Going into next week, I'm really thinking about distribution, and I know that's going to be a source of stress for a lot of parents. Currently, the majority of pharmacies can't actually vaccinate babies and toddlers or children under 3. Are there going to be any movements to try to help to support pharmacies to be able to vaccinate? And also, I hear a lot of pediatricians saying that they aren't actually going to offer the vaccine because of storage issues. So just love to kind of hear a little bit more about that.
Right. So, we've done obviously kids 5 and above. There is a different set of issues for kids under 5, and particularly kids under 3. There are some specific challenges with pharmacies. Now, you will see some pharmacies vaccinating kids as young as 18 months if they're doing it through their minute clinics. So CVS minute clinics can go lower. And this has to do with the PrEP Act, and there's a set of kind of regulatory issues that make that harder. So in our mind, what we want to do is we want to open up as many opportunities as possible. Obviously, pediatricians' offices and family physician offices, in some ways ideal because you have a relationship. That's where I think a lot of this is going to happen. We're working with America's children's hospitals, because children's hospitals are, even if you've been lucky and your kid hasn't ended up at a children's hospital, you often know it, you trust it, they're full of pediatricians. So that's a great place, and a lot of children's hospitals have stepped up and said they will offer up vaccination clinics. We've got community health centers. So we're really trying to expand that set of options. I think what I'm hearing from pediatricians' offices, certainly some of the bigger pediatricians' offices are going to do this. The one physician office, it's going to be potentially a little bit tougher. We've worked a lot on trying to make the lot of vaccines smaller so that even if you don't have a big population, but that will be challenging for some pediatricians. We've often also talked to pediatricians and like the AAP about groups of pediatricians banding together and ordering and then sharing and bringing and doing a joint clinic. So you're going to see lots of different types of innovation. Ultimately, our hope is over the next few weeks, you'll see lots of options, and one of them will work for you. And obviously we're always open to new ideas as well. But we've been in very close contact with the AAP and AAFP. Those are the American Academy of Pediatrics, American Academy of Family Physicians, because they're the key people that we want to be working with on this.
As a mom, the formula crisis makes one, of course, because we worry, that's what we do, start worrying about other things, like my son is allergic to bees, is there going to be an EpiPen crisis, or is there going to be an albuterol crisis, and what is the administration doing kind of far-reaching to make sure this kind of thing doesn't happen to families?
Well, I think that there have been a lot of challenges with the supply chain in general because of COVID-19 and the impacts upon businesses and transportation. I think that is much better than it used to be. So the FDA, of course, monitors the safety and effectiveness of different medications. We don't usually watch the supply of specific medications, but I certainly, if we have any indication that there's going to be a shortage, then I think that we will be very proactive about those issues. There certainly have been issues in terms of, for example, insulin and the price of insulin that the administration has been very involved with. It's hard to predict which medicine and which food we have to watch more closely. There are a lot of medicines that children take, but we will be very observant and watchful and do everything we can. I did want to highlight, because Dr. Jha was talking about the American Academy of Pediatrics and the American Academy of Family Physicians. In this issue as well, your pediatrician or your family physician is a tremendous go-to resource, because I don't know your baby, and you know your baby, and your pediatrician, your family physician, your community health center, they know your baby. And so if you have questions about formula, about feeding, about which formula, about what changes you might need to make, about schedule, all of that, please talk to your pediatrician, your family physician about your specific baby and your circumstances.
And with that, we're going to end the press briefing. Thank you so much for joining us tonight, and we'll see you guys again soon. Thanks, everybody.
Could you take some questions from us too? Could the Admiral take one question perhaps about the formula crisis?
That's not, we're done, guys. Thank you, though. Thanks, everybody.
We're gonna have to wrap. Thank you so much.
Admiral Levine, could you share?